to finish the quest in Stonehaven.
Stan? Stan?
Hang on, guys. My dad wants something.
Stan!
What?
You've been on your computer all weekend. Shouldn't you go out and socialize with your friends?
I am socializing, Artard. I'm logged on to an MMORPG with people from all over the world and getting XP with my party using TeamSpeak.
I'm not a artard.
All right, sorry, guys. So where to now? See where I am? It's this way. Yeah, come on, let's go. Right-click on me to follow. I am the mightiest dwarf in all of Azeroth.
Computer, internet, and video game addiction has been a controversial issue from as early as 1986 with the release of Margaret Schoeten's book, Computer Addiction. Well before online gaming and web surfing, Schoeten described problematic obsessive computing behaviors during the infancy of personal computing. Periodically since then, researchers and mental health professionals, educators, and parents have expressed concern about computing excesses in our growing technology age. But for every chorus of concern, there are equal numbers claiming the excesses are not an addiction or mental illness, but simply poor parenting, lack of self-control, or symptoms of other mental illnesses. Computer and video game manufacturers deny their games are addicting and state they are simply attempting to make compelling, enjoyable, and challenging games, and that individuals and parents must take personal responsibility to moderate play. They have even incorporated parental controls to make this task easier. Recently, though, evidence is mounting that suggests that some of these excesses are similar to addiction. Both China and South Korea have experienced such significant problems that they have defined computer addiction as a mental illness, created state-run treatment programs, and China has even legislated usage limits to reduce the problem. A large-scale Iowa State University study released in 2009 found that 8.5% of children players reported significant negative behaviors and consequences of play like those of compulsive gamblers. I'm Luis Bautista, and here to discuss this controversial issue is Dr. Kenneth Woog, a clinical psychologist and computer scientist who has been researching and treating individuals suffering from the consequences of excess computing since 2002. Dr. Woog is Associate Director of PRYDE, that's P-R-Y-D-E, Pepperdine University's community-based graduate marriage and family therapy and psychology clinical training program in Irvine, California. Dr. Woog also maintains a private practice in Southern California, specializing in gaming addiction. Welcome, Dr. Woog.
Thank you. I'm really glad to be here.
Thank you. In 2007, the American Psychiatric Association decided that there was insufficient research to add internet addiction disorder to their upcoming Diagnostic and Statistical Manual, the DSM-5, thus not defining it as a mental illness. Do you believe that internet addiction is a distinct mental disorder?
Well, yes and no. I think part of the problem is that we've tried to define internet addiction disorder a bit too broadly. I mean, there are a lot of uses of the computer that, when used to excess, can result in negative consequences on the individual. But not all these are specific to the computer. You have web surfing or chatting or sexual uses or gambling and shopping, and these are all using the computer simply as a mechanism. So when we look to define this disorder, I think we need to look at behaviors specific to the computer only, or video game. And I use the term video game and computer interchangeably because video game consoles really today are just internet-enabled computers as well. But I think that we need to look at issues only specific to the computer. Now, computer gambling would be an example of one thing that I would consider to be specific to the computer, except we already have pathological gambling, which is a known mental disorder already. So web surfing, chatting, email excesses, these are all done, and we all know they're done to excess, but these again are just ways to communicate or access the computer, and they're really not specific to the computer alone. In 2003 and 2004, I conducted a nationwide U.S. postcard survey of mental health professionals, asking them about their experiences treating problematic computer or internet use. Computer gaming was the #1 endorsed problematic use of 11 to 17-year-olds, and the #1 problematic use that I believe is distinct to the computer. And that's why I focused my efforts in researching and treating problematic computer gaming. In my survey, I also asked if clinicians believed problematic computer use was a distinct disorder, and found an interesting correlation. For clinicians that had not seen any cases of computer excesses in the past year, only 30% believed it was or could be a distinct disorder, compared with 52% if they'd actually seen someone with a problem within the last 12 months.
So, Dr. Woog, why do you think this issue has become so controversial?
Well, I think besides the lack of conclusive research, the idea of addiction itself has been very controversial. Some believe that, for example, that it's just a moral choice and there's no such thing as a real addict. And further, the idea of a behavioral addiction or soft addiction has been very controversial because many believe that, in fact, only substances like alcohol and drugs can cause an addiction. So critics say, you know, what's next? Reading addiction, TV addiction, these are all behavioral excesses, and I'm sure we're all aware of that. But we use the term addicting to define that, and I think that that's part of the problem. Fortunately, over the past decade, the science of addiction has been advancing rapidly. I'd like to take an opportunity to share some information from the National Institute on Drug Abuse, or NIDA, which is a division of the National Institute of Health. So substance addiction is believed to be caused by changes in the reward center of the brain. And the brain structures implicated, this is in the midbrain, as the reward center are the ventral tegmental area, the nucleus accumbens, and the prefrontal cortex. Now, the purpose of the reward center is to ensure that we will repeat life-sustaining activities by associating those with pleasure or reward. Whenever this reward circuit is activated, the neurotransmitter dopamine is released, and causing the brain to note that something important is happening that needs to be remembered, and teaches us to do it again and again without having to think about it. Dopamine is also released in response to pleasurable behaviors, but when addicting drugs are taken, they can cause the release of 2 to 10 times the amount of dopamine that natural rewards do. In some cases, this occurs almost immediately, as when drugs are smoked or injected, and the effects can last much longer than those produced by natural rewards. The resulting effect on the brain's pleasure circuit dwarfs those produced by natural rewarding behaviors such as eating or sex. The effect of such a powerful reward strongly motivates people to take drugs again and again. So it's reasonable to assume then that playing video games also results in excess dopamine release, and brain scans of youth playing games confirms this. And unlike sex or food, you know, this dopamine release can happen continuously as the game is being played. Brain scans also confirm that the more exciting and the more entertaining a game is, the greater the amount of dopamine release. So the logical conclusion then is playing video games, compelling video games for 30 plus more hours a week for periods of weeks or months could result in sufficient dopamine release similar to that occurs in addicting substances. At this point, the individual, despite negative consequences, can't limit their intake of the game. And for those skeptical about using the word addiction, this is the exact definition according to the National Institute on Drug Abuse.
You know, I'm wondering, what parent lets their child play computer or video games for more than 25 or 30 hours per week?
That's a good question. I think it mystifies a lot of people. You know, but I found gaming excess is really more of a result of inability to limit use rather than negligent or ignorant parenting. Usually play begins with reasonable limits, and then over time it gradually increases to excess as the game becomes more interesting or compelling to the player. So they start staying up late, playing when they should be doing homework, and lying about their play. This then forces a parent to try to coerce the child into some type of self-limiting. And usually these are by idle threats that are made. And unfortunately, that usually doesn't work. And then we're on to the next step, where the parents need to try to enforce some type of parental control. Some parents are technically capable of setting up parental controls, and others are not, and some might even be afraid of the child's reaction to set them up. So eventually, most do set up some type of parental control to limit use. But this tends to start the first cycle of what I consider to be a number of observations that I've made in what can eventually result in excess use and ultimately addiction. In the first phase, the individual uses the computer to excess, and then periods of escalating anger, poor school performance, sleep issues usually result. In response, parents exert some form of weak parental control by removing the keyboard or the mouse or the power cord, or install some form of parental control software. The child then is challenged to find a covert solution, you know, an extra cable or hacking the parental control software. And when the child is successful, the parents, of course, get frustrated, and this often starts a cat and mouse game. After repeated cycles, parents either 1, give up, thus allowing unlimited use, 2, remove the computer from the home, and 3, seek professional help.
And how long can this cycle last?
Parents can go around and around in this cycle for years. And it's really the weak parental controls that contribute to the problem. And by weak, I mean any parental control that can be easily defeated by the addict, including otherwise quality products that were in the hands of technically incapable parents. Now, if the parents get frustrated and elect to remove the computer as a consequence, this often leads to what I call the abstinence relapse cycle, where once the computer is removed, the child's behavior improves and through persistence and manipulation convinces the parent that it will be different this time and they will limit their own use. Now, for those not addicted, perhaps once or twice through the cycle will be enough to change behavior. But for true addicts, this is not possible. So we start the cycle again with increasing levels of use. So each time through the cycle results in damage to the family relationships. Also, each time, it's possible that the parents will give up, remove the computer, or seek professional help. This cycle can go on for years. So if the parents decide to remove the computer long-term, or make returning it contingent on behavior or academic improvements, and the child is either strong-willed or older, you run the risk of falling into the final cycle, which I call the parent-adolescent power struggle. At this point, parents are often at their wits' end and fall into a power struggle with the child. This phase is sometimes actually suggested by the now frustrated therapist. In this cycle, the child pushes back on the parent's demands with their own. Either give me back my computer or I won't go to school at all. And guess who wins? Even more frightening, it's this phase where suicide attempts are made. And parents now have few options, either hospitalization, residential treatment, changing therapists, or just giving up. This cycle usually doesn't last long, only between weeks and a month perhaps.
Well, we know that recent survey studies suggest that 8.5% of players are addicted. Is it really that bad?
Yes, and I believe it's getting worse. I mean, first, the consequences of play can be pretty severe. Academic loss, loss of job, loss of employment, dropping out of school, both high school and college, serious family and relationship conflicts, even repetitive stress injuries or health injuries, obesity. These are all serious problems. Even violence, depression, and suicide. And I know while these don't really compare to the overdose risk of certain addicting substances, it shouldn't be trivialized. And as for how many are affected, early researchers suggested as many as 40% of gamers were addicted. And of course, the recent survey is saying closer to 8.5%. But I believe a greater number, as many as 20%, actually play to excess, resulting in significant negative outcomes in their lives in academic, occupational, or social functioning. But even if it's only 3%, I mean, that's a lot of people, and they rarely seek professional help. And I believe it's a growing problem. I mean, the gaming industry itself has improved in both the quality of the games and the demographic appeal. And the industry has grown, like in 2007, grew by 25% to over $18 billion sales.
Why is it so important that computer or video gaming addiction ultimately be defined as a mental illness?
Well, so it can be properly diagnosed and treated. I mean, even today in the United States, very few actually seek treatment until things get really, really bad. And when they do, it's often without a diagnosis or any proper standard of care. And I can't tell you how many 17-year-old, parents of 17-year-olds call me and tell me how much therapy, how much medication, even hospitalizations their child has endured, and yet the child remains addicted. So parents believe their child's addicted, although all too often the therapist tells them there's no such thing.
When were you convinced that video computer gaming addiction was a distinct disorder?
I was convinced after my research in 2004. And while it might seem logical that someone with a background in both computer science and psychology would be researching this area, it actually, my involvement was totally by coincidence. I received a referral for two 15-year-olds who, at the same time, had problems with computer gaming. And this was in 2002. And one young man had not been to school for months, and the other young man had attempted to strangle his mother with the power cord when she pulled the plug on his computer game.
That's rather violent behavior. Is this common?
Surprisingly, yes. Especially when parents attempt to try to limit or stop computer gaming when a child's in the middle of a game.
So these two young men, how did you end up treating them?
Well, at the time I didn't think it was a distinct disorder, so I attempted parent training along with individual and family therapy. Now, both families were intact, no history of mental illness or addiction, and they were middle class, professional, and attempts to cut down and cut out computer gaming resulted in psychiatric hospitalizations and excess violence in the home. It was really out of my frustration in working with these two young men that I decided to do my survey and study and looking for more effective treatment methods.
What did you find out?
Well, first I wanted to know how many clients were being seen by therapists and with the problem, and then what were the effective treatment methods. And what I found was clinicians reported seeing 3 clients on average, with only a small minority being minors. An interesting research item was that it turns out at that time 50% of clinicians reported knowing someone personally with the problem. And many different treatment methods were reported. Cognitive behavioral psychotherapy was the #1 reported treatment method, followed by family and marital counseling. Behavior therapy and medication were each endorsed by about 1/3 of those surveyed. Almost 20% supported abstinence and 12-step programs. Only 17% recommended moderated use, and only 8% used some type of software to limit use.
Which of these treatment methods have you found to be effective?
Well, unfortunately, I found what didn't work first. Treatment methods borrowed from substance abuse or gambling were generally ineffective with younger addicts, including 12-step programs and abstinence. Most gaming addicts don't really believe they have a problem, and they aren't willing to participate in any type of 12-step program. It's a moot point anyway, because there really aren't any groups out there. In fact, the only group that's available, Online Gamers Anonymous, only meets online. And while some clinicians advocated abstinence, I think that's unrealistic for most young people. I mean, if that's what they want, that's fine, but it's usually not the case. And, especially for adolescents, when they're playing, their life's invested in playing 30 to 90 plus hours a week on the games, that's their entire world. And you can't ask someone to stop that cold turkey. If you do, you really risk depression, anxiety, violence, and you might need residential or hospital treatment in order to go that route. Now, I saw that firsthand, unfortunately, and also from really reports of parents that have reached out for me for help. And I also found that individual family and marital therapy was generally unhelpful alone. I mean, it's insufficient in a sense because in treating the addiction. And yeah, you might need to do that. You might need to be working on some of the relationship issues. But until you really get a handle on the addiction, those other problems aren't really going to go away. This shouldn't be too surprising, really, because, in fact, those types of therapies have never been the sole course of treatment for addiction. Ultimately, I found that moderated use was the best option. And there seems to be a growing agreement among those that specialize in that area. And I know it's a significant departure from substance abuse treatment as usual, but that's what I found to be effective.
Moderated use, how do you accomplish that?
Well, through the use of strong parental controls, and not through nagging, pulling the power cord, or even shutting off the main circuit breaker.
Okay.
This is a behavioral problem, and it requires a behavioral solution. So it's my belief that if the addict is allowed to use the computer according to set limits on a daily basis and then tapered down gradually, the addiction's broken. This method carries less risk of a serious adverse reaction and is better tolerated by both patients and parents or significant others. I found this simple behavior therapy worked when years or months of therapy didn't.
Tell me, how does tapering down use break the addiction?
Well, this is just a theory, but I believe it works by reducing the rewards of the play. Now, I should explain a few concepts. First, abstinence doesn't treat addiction. While 12-step programs advocate abstinence, it's really the reward system of the individual that's being changed by their reinforcement from group affiliation or accountability, spirituality, and belief in a higher power. And I said before that addiction is caused by changes in the reward system, such that what is learned, what is pleasurable. So an important concept in learning and memory is that what is learned can't be unlearned. It requires new learning. We can only learn new information. So a concept in tapering down is that by playing the game now with reduced rewards, over time, the reward system learns new information, and in fact, the game is not that rewarding, and that information overtakes the old information. Now, we can't manipulate the reward system of the game themselves, although actually that's being done in China with their limits. But with certain kinds of games, only slightly reducing the amount of playtime can actually alter the reward system. For example, in the game World of Warcraft, players will play a 3 to 4 hour game called a raid. This is an activity where they go and they shoot monsters to try to win, and it's played in a team of individuals, as many as 30, 40 people playing together from around the world. But when they win, they divide up the loot or the spoils of their game based on the participation in the guild. So the individual who's played the most gets the most loot. So the idea is, by reducing the amount of play, it lowers their ranking in the guild. And this happens even only with slight reduction in the amount of gameplay. And when the reduction in the ranking drops, in a sense, the reward of the game drops. When the reward of the game drops, of course, they learn now that the game is not as rewarding as it was. In fact, can even be sometimes frustrating. And another aspect is, as they're cutting down or unable to play, there's some social consequences too, because the guild or team depends on them to play. And when they can't play all the time, then they tend to be not ostracized, but not held in high regard as they were before. And ultimately, they become frustrated and lose interest in play. Of course, we want to do this in a gradual manner that's not beyond the individual's ability to cope.
Tell me, if computer and video gaming is so addicting, why doesn't everyone get addicted?
Well, I don't know if there's any research in this area, but I think that it's likely that it's similar to substance abuse. So I would guess it's things like the qualities and the nature of the game, the amount of play, and that combined with the age of onset of play, and also the individual's biology, including their genetics, play a role. Personality traits may also play a role. For example, I found more introverts addicted than extroverts. Now, I don't know if it's a trait issue or if just more introverts are game players. But clearly we need some more research in this area.